silliness. So I do appreciate everybody being here and being timely. My name is Dr. Karin Duncan. I'm a naturopathic medical doctor over at Coeur d'Alene Healing Arts. Everybody familiar with the clinic over there in Coeur d'Alene? We're one of the longest standing naturopathic clinic in northern Idaho. Founded about 35 years ago by Todd, and then recently acquired by Dr. Hunter. Not recently, I guess it's been 7 years now that he's been running the clinic. I joined the practice about 1.5 years ago, right after I had my son, and am practicing there with the primary focus on neurologic disorders. Has anybody been on our website, read my bio? No? Yeah? Oh, good, great, you get a gold star. So the very first thing I'm going to say is this is interactive. I know it says open forum, I know it says I'm going to lecture, I have a few things to say, but in my time spent lecturing in the community, what tends to happen is more people come with questions than they do wanting to hear anything that I have to say, which is just fine. So I am going to chat for a while, have a little manuka cough drop in, forgive me. And I want it to be interactive. I want you to ask questions. If you feel like you're interrupting a thought of mine, hold, raise your hand, and then I'll ask you. I'm not going to ignore you, but I do want to practice that kind of etiquette. There's going to be times I'm going to ask for participation from you guys, so please participate. It's awfully lonely up here if nobody plays along, so get involved. And neurologic conditions, they're a tricky one. Why would I ever go into that field, right? No one understands it. It's a universe unknown to pretty much every health practitioner out there. 14 years old, I became the primary caregiver for my dad, who was diagnosed with brain tumor and suffered the neurologic consequences for the rest of his life. And spent my entire time as a caregiver and not acknowledging the fact that I was a caregiver. I was just a really, really good daughter. And when I went to medical school, I recognized I was indeed a caregiver, and those people and our patients are falling through the cracks over and over and over again in the conventional system. And they do great work at keeping people alive. Not so great all the time at quality of life. So I chose the field of medicine I went into because I wanted to do more for people like my dad, for people like me, and for people who have neurologic conditions that have been told, hey, it's cognitive decline, that's all we've got. So I have spent the mass part of my career focused in Parkinson's disease. I was extremely motivated by a mentor of mine at Bastyr University over in Seattle, who's spearheading research all across the universe, the globe in Parkinson's disease. She speaks at the Parkinson's Congress every year, and has brought so much light to what we can do to slow the progression of that disease. And I started applying a lot of those theories and concepts, also the Dale Bredesen work of ending Alzheimer's, kind of morphing and adapting and going through all these things for my patients who show up with, hey, I was told I have cognitive decline or early onset dementia or something like that, and that's it. See you in 6 months, see you in a year, go exercise. Oh yeah, I also have osteoarthritis and I need a hip replacement. The exercise isn't my, that's not the only option. So that's really one of my favorite situations to be placed in. The reason I chose lab values is because we talk about, especially as naturopaths, here's all the things we can do, right, to heal from the inside. How can we heal ourselves? How can we be one with nature and not need any therapeutics or medicine and just really enhance our healing power? And I do believe that exists, but I'm going to be the first one to tell you, and maybe you're going to want to walk out of here, is that medicine is necessary. We all have physiologic vulnerabilities. Every single one of us has a chink in the armor that we need to address. And in order to address it, we need to find it. And in order to find it, we need to have investigative strategies. Cons of labs is that it's a snapshot in history of your life right then when you got your blood drawn in an anxious moment and you're dehydrated because they told you couldn't eat, right? So you're like, I feel like crap, you're going to take my blood, maybe I'm going to pass out, and then my doctor's going to hang their hat on everything that they see. That also doesn't happen in my office. It gives me clues. It helps me with my detective work. Where are these vulnerabilities? How can we restore vitality and resilience in other parts of your body so that it can do what it was designed to do, and that's compensate for the vulnerabilities. Our body is designed in this extraordinary way that made me pause during med school all the time and say, can somebody just pause for a second? Can you hold the phone? This is how that works. This is a compensatory mechanism for that. We have a backup to our backup. whoever you believe designed the human body was the most phenomenal engineer ever. So it's really exciting. So to do the detective work to figure out where is that vulnerability, what's the compensatory mechanism, and how do I build that up is really exciting to me. And I love doing it with the brain because there are so many aspects to it. The majority of my time I spent talking about poop and your nervous system. Poop in the nervous system, poop in the nervous system, all the time. Anybody who comes to my office, you better be ready to share about your poop and more descriptors than you could ever think imaginable about that toilet bowl. It's really important for me to know what's happening on that end so I can know what's happening on this end. I gave a talk not too long ago on the community outreach called The Constipated Brain. Just talking about what happens when we suffer from GI distress and constipation and how that affects our brain. So it's exciting. I go off on tangents. I talk quick. I get excited. I'm going to move around. Like I said, raise your hand, stop me, ask questions, share if you want to, challenge me if you want to. I've got pens. I want to take notes. I learn from you just as much as you learn from me at these things. I think it's really incredible, and I love being here and part of the community. So, any questions so far? No? We're good?
Good.
Half of you look excited, half of you look like a little skeptical. Which is okay. Does anybody want to share what their goals are for today? Yeah.
I would like to have a better understanding about neuropathy.
Okay. Neuropathy. So I knew this would come in handy. Way to start with a hard one. Anybody else curious about neuropathy? Okay. What else?
What's constipation have to do with your mental?
Yeah, good question.
Does that cover it?
Yeah.
What else do we got?
Blood-brain barrier in relationship to vaccination.
The blood-brain barrier, you said?
Yes,
Okay.
and in relationship to COVID.
Okay.
Can you repeat that?
The blood-brain barrier and its relationship to COVID. Yes, ma'am.
Sleep apnea.
Sleep apnea and how it affects the brain?
Yep.
Insomnia.
Okay. Is anybody here to learn about labs?
What?
Is anybody here to learn about labs?
Yeah.
Oh, okay. No, I'm just curious. That was the title, and I just wanted to make sure. That's anything else?
What about snoring? Is that related to the brain?
Sure. We'll talk about snoring. Kind of group these all into your sleep disease.
So we do a powerful smoothie every morning with beet greens and whole beets and really lots of fiber and everything. But if I miss one day and decide to have bacon and eggs for breakfast instead of my smoothie, it takes me 3 days to get my bowels going again.
Yeah. How about nutrients
Yeah.
in the brain?
Okay, about labs. Are you talking about just blood work, or are you also talking about MRIs and PET scans?
I wasn't going to go into imaging, but I can definitely touch on imaging. I was going to talk about blood work, urine, and breath, stool today, and how those apply.
Restless leg.
Mhm. Okay, last call? Just kidding. All questions are fair.
That's a lot.
I know. You got a lot to cover. What do we got here? Hour and 15. Are we ready? I did have my second cup of coffee today too, so I just want to usually I'm on 1 cup a day. Okay, so let's start off with labs. That's what we're here for. So says the title. So lab values, I already mentioned, snapshot in history. What is the reference range? Does anybody know what a reference range is based off of?
I don't know what they base it off of, but I know what it is. You're supposed to fall within the lowest and the
It's
highest.
supposed to fall within it, and if it's anywhere within it, you're good to go, get out of here, your symptoms don't matter. Yep, right, you're in the green. Lab value reference ranges are based on they test a large population of people. Most of the time, conventionally speaking, it's middle-aged white men. Healthy, otherwise healthy, and the values that most of them fall into are considered normal. No offense to you, But I don't see any middle-aged white men in here.
It's not middle-aged.
Well, I know, that's why I said I didn't want to offend him. So the majority of my patients aren't going to be middle-aged white men. The majority, we can't base a lab value off of one group of people in the universe. I recognize that they have to start somewhere. They have to come up with reference ranges, but they differ. The normal values, person to person, differ. And I'm going to tell you what, if you fall in the green and you're coming to me and you say, my thyroid is sluggish, I don't care what that says, I'm going to listen. And maybe it's your thyroid, maybe it's something else. But lab values are a tool. They are not the end-all be-all. I want to make sure that that's certain, especially as I go into just how important it is to have lab values, that the disclaimer is that it is really a tool. The next thing I want to chat about is the supplement industry. I always like to throw this out. The supplement industry is not regulated by the FDA. Yay, boo. It'd be great to have some regulation there so we know what we're putting in our body. It also hasn't worked out so well for the pharmaceutical industry. So here's where we're at. I will say, with no conflict of interest or bias, see a naturopathic doctor if you want to get on supplements. Pilgrims has a great stock here. They're not physicians. They don't know if you're on a blood thinner. They don't know what your health history is. They don't know what your allergies are. They're not going to ask you your other health conditions. Supplements are not benign. If you're taking notes, that's what I want you to write and underline in capital letters. Supplements are not benign. Just because it's natural does not mean it's good. There is an entire textbook of supplement, herb, botanical, nutrient, pharmaceutical interactions. Safety with supplements is one of the most common things that I see in my practice that takes at least 2 visits to undo before we can get to what you're there for. It takes so much time to filter it out, take you off, help your kidneys out, make sure that you're on the right thing, and quality product, therapeutic dosing, all of the things that go into it. So I don't treat supplements any different than pharmaceuticals, by prescription only. If you have a supplement that works for you, please, please, please do not go give it to your neighbor's cousin's friend's daughter. You don't know her health history. You don't know if it's safe for her or not. You don't know the proper dosing for that age. These things matter. We have extensive training in it, and that's the one thing that I could say, what do you want your legacy to be as a naturopathic doctor? It might be that. Of all the things that I do in my office, it's bringing awareness to the fact that these things that you're putting in your body are not safe. I always give kudos to those who go source it, try to figure out what's good for them, read the research, and do what they can do. But I can tell you 9 times out of 10, when somebody comes to me with a supplement list of over 10 items, I'm taking them off because I see their kidney function is declining. Everything you put in your body, your liver and kidney has to filter out. Whether it's good for you or not, it has to filter it out. So that's my soapbox for the supplement industry. Also, they have done trials where they take a supplement with the same label that you get at Pilgrims or Coeur d'Alene Healing Arts. Pardon me, this is going to happen all night. I talk all day for a living too, so. And if it's not by a correct distributor, they have found sawdust, they have found fillers, preservatives in the capsules with the exact same labeling. So, please source responsibly and consult a doctor.
Can you just repeat that, what you said?
Mhm.
So same label?
Same label, sold at a place that's not reputable, Amazon. Amazon. It is very scary. Thank you. Say that louder. It is scary. You're out there trying to do what's best for your body, and you could be taking sawdust, preservatives, fillers. Not only that, at a less invasive level, they don't meet label potency. We have an entire website called Consumer Lab Report that some supplement brands will pass for a certain supplement and fail for other ones. So it's not always, this brand is always a good one. It's literally every single one has a different quality marker to it. So I say that because 1, I want to help you. 2, I want to help you. And when we spend all of our time together at the beginning, I'm doing things that may be harmful, that cost time and energy and money for you guys involved. And then 3, some of them do cause harm for long-term effects. Kidney disease is the biggest one that I see. So I don't want that to be a result of what you're doing. I would say, let me help. Let me take that burden off of you. It's really easy to say, hey, here's my list, here's what I want to do, or just, I'm going to stop everything, I'm going to go see a doctor and see what's indicated for me. Sound fair? Any other questions?
Yeah, go ahead. You mentioned consumer labs.
Mm-hmm.
Is that a good source to check out a particular brand?
It is. It's for medical professionals. I don't know if anybody can sign up. It's a yearly subscription.
Well, I've seen it on the online, so I was curious if that's something that.
I use Consumer Lab all the time. Of course, with any sourcing, any of us with the scientific mind is like, okay, well, who's funding Consumer Lab, right? You can always backtrack it there. For my purposes and my practice, it works really well to filter out which are meeting market potency, which have been passed with fillers, so it gives me a starting place. When you're looking for purity, it's challenging, but we do our best to source.
So to tag on to one more question, that is, when you read in the back of the label where it says suggested dosage, 3 capsules a day or something like that, but that's based, like you said, on an average middle-aged white male. So that 3 pills could probably be too much for me, or?
Yep, and to be really honest with you, I have no idea what they're basing that on. No clue what the dosing recommendations on the bottles are made from. I probably should, but what I use is another resource to say, hey, here's what the research says for how much milk thistle we need to help with fatty liver disease, right? Here's how much milk thistle we need to help with insulin resistance, 400 milligrams daily. The milk thistle bottle could be for multiple different reasons, and their dosing may not be 450 milligrams. So again, it's by health condition, it's what results you want to see. It's if you have deficiencies, if you have biochemical vulnerabilities. There's a lot of different factors that play when we prescribe a supplement. Does that answer your question?
Yes.
So I take a calcium supplement that Dr. Schlafner recommended to me, but the dosage on the back of the label says 8.
Okay.
And he said, no, I don't want you to take that much.
Yep.
And he told me how to take it and how much to take.
Perfect.
Yeah.
And that's why you get a doctor.
Yeah.
We do. I think we can put a period at the end of that rant. Except I was going to say one other thing, but I lost it. It'll come back. Any other questions on supplementation? One more caveat. Who in here uses essential oils? Yeah.
Internally or externally?
Either or. Yep. This is going on record, so you know I'm always that, but there's exceptions to the rule. Never an exception to the rule to not ingest essential oils internally. Don't do it. Toxic, toxic, toxic to the liver. I don't care what your doTERRA rep says. Do not ingest your essential oils internally.
What are they?
What essential oil is an extremely concentrated concoction of an herb that they extract by steam distillation and then pack it down into oil. And so it's very, very potent and very, very destructive to the
Are
liver.
you supposed to take it in a capsule? Or is it rubbing it on your?
So even rubbing on your skin, okay, so that was going to be my second thing. People who use them topically, do it with caution and consult a doctor. Oils are lipophilic, which means they like fat. They're absorbed into the skin and into the bloodstream quick. They still can cause damage to the liver. A little less potent than when you ingest it, but still can be extremely toxic. Again, I have seen elevated liver enzymes because people are using essential oils topically. So everything that you do, topical, what you use for your face creams, your hair, everything that you're doing has an effect on the body. Fear factor. Now let's take it back a step. You have detoxification organs in your body to help you with the insults that we run into. Environmental medicine was never my jam because it was too scary. Everywhere you go is scary. Don't touch anything, don't breathe, don't look, don't eat. It's like, oh my gosh, I can't do anything. How do I live clean? I live clean by trusting the fact that my body can process a lot of these if I take care of it and do things in moderation. So there's always going to be a moderation disclaimer there, except for internal use of essential oils.
So what about oregano? That's one of the really good ones for our immune system, and it's an essential oil.
It can be dosed as an oral essential oil for antimicrobial effects. And I would consult with your doctor if that's something that you want to do.
Okay.
What about diffusers?
Diffusers are very safe as long as you're doing it in a dose that's appropriate. So I usually say in a diffuser 5 to 10 drops depending on how big it is, and then also not, taking a big whiff. That's direct route to the brain.
That's my
Same question?
Yeah.
Yep, okay. All right, back to labs. Anything else on supplements? That always tends to get a lot of, wait, what about this? Cool, we're good, we're safe? All right, complete blood count. Who knows what we're looking for there? Anybody? Yep.
Well, you're looking for the red and white cells, you're looking for the kidneys, you're looking for liver enzymes, you're looking for the lipid profile. What else?
You started off great. So complete blood count is actually just white blood cells, red blood cells. Yep, the rest of them are in further panels. We're looking at immune function, anemia, and nutrient deficiencies are the first 3 things I'm looking at when I look at red blood cell, white blood cell, hematocrit, hemoglobin, right? And then they break down your white blood cells, how many neutrophils, lymphocytes, different things like that. That pertains to the brain, right? Because we're looking for infections. We're looking for your immune system response, and we're looking for inflammation. If we can see and anemia, right? If we've got anemia or we've got big red blood cells, that could show a B12 or folate deficiency. It can also show an iron overload. I have diagnosed hemochromatosis, which is a genetic disposition for excess iron, twice this year in people in their 70s. Has been missed for that long. So there's a lot that we can tell when we look at these blood numbers. That's what we're looking for a CBC. It's a very basic lab. Most of your doctors will run it. That's the information we're getting from it. Complete metabolic panel. That's diving into your liver, kidney function, your electrolytes, your blood sugar, right? Your blood glucose.
Do you do those blood tests at your clinic?
We order all labs through our clinic for the most part, even specialty labs that we'll get to later. So health of your organs, we kind of touched on a little bit, the detoxification process, right? The kidneys and the liver are 2 of the big ones. Our skin, our lungs, and our poop. Those are our 5 eliminatory organs, right? I always say there's 2 more not to be ignored. Anybody know what those are? 2 other ways that we detoxify?
Lungs.
Good start. I said lungs, so
What gland?
I said skin.
Oh,
Yep, it's good. Think outside the box here. Air.
hair.
That's lungs. Yep. That's good.
Intestines.
That's poop. How about emotions?
Stress.
How about sex? How many of your doctors tell you, do you have an orgasm regularly? How's your erectile function? Do you feel intimate with your loved one? Do you feel safe? Those feelings are extremely important to lower inflammation, to rest your nervous system, to help boost immunity. I don't care how old you are. I'm going to ask you about your penis and your vagina. They've been around just as long as you are, and they deserve just as much attention as the rest of your body. So if you come to see me, be prepared to share. It's an important part of your health. So, you know you're getting sex ed here too, right? We're talking about your brain.
Name those 5 again.
Mhm.
The skin, the lungs.
Mhm.
I
Liver,
missed 2 of them.
kidney,
What else?
Liver.
Yep,
and poop.
and poop.
I got those poop.
Yep, some people would say your colon,
Oh, kidney.
but I think poop is more fun. It sounds detoxifying. So that metabolic panel, huge, huge key into what's happening in your body. I tell a lot of my patients, I can't dissect you right now while you're alive, damn it. But looking at your metabolic panel gives me so much information on how your body is balancing. A lot of times these electrolytes will be off a little bit. I don't know how many times you've been to your conventional doctor and you're like, oh, it's a little off, it's okay. Oh, that's a little bit off, that's okay. Those little bit of offs give me so much information on what is the vulnerability, what's missing there. And a lot of times we don't get the answer from a basic blood work panel, but it gives me a clue. Where do I track down there? Is it an ion channel deficiency? Is it an amino acid deficiency? Is it nutrient? Is it absorption? Are we hyperventilating? Is it a stress response? Are we taking magnesium oxide for our poops or pulling too much water into our colon? There's so many different things that it can lead me down the road to investigate further to find this ultimate root cause of disease, right? So we all say we're going to find the root cause of disease. I'm almost 40 at this point. I'm like, I don't care what the root cause is, just fix me now. But it'd be nice to know where it started, right? Okay, blood sugar. How many people, if you want to share, have blood sugar dysregulation? High, low, insulin resistant? You're not going to share. Chances are somebody's got it, because I have low, so I'll say one in the group anyway. Low blood sugar.
How do you know?
How do I know? How do I know? Sorry, first.
How would I know if I get it?
Blood testing,
Okay.
symptomatically.
Then-
Yep.
So when we have our annual physical, we always test for our blood sugar.
Great,
So if it's normal, and we have a good doctor,
great.
so we're okay?
So you should be good.
Okay.
Blood sugar, I always tell people, is just like sugar on the outside. It's a sticky little gremlin that sticks to your nerves. Who asked about neuropathy? Yep, neuropathy. Sticks to your nerves, sticks to the sides of your blood vessels, sticks to immune cells, sticks to everything. It just goes in there and it sticks. And then it globs everything up, just like it does on the outside. So when we have blood sugar dysregulation, it affects so many of our normal physiologic processes that neurologic health is compromised. Think of the extremities in your body: fingers, toes, nose, ears, genitals, brain. I always say brain. Why? We have the blood-brain barrier. That was brought up. It takes a lot of work for your cardiovascular system to get anything to your brain. For good reason. We want to protect it. Also it's tough. We want to get it up there too. We have to be in really good cardiovascular health to get the nutrients to the brain. Those blood vessels that deliver to the tissues of the brain are teeny, 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 tiny capillaries, just like at the ends of your fingers, just like at the ends of your toes. If somebody comes into my office, I have cognitive decline, I have blood sugar imbalance, and oh, I have this numbness in my fingers and my toes, I'm saying your brain is feeling that too. What you're feeling here is happening up here. It's a lack of perfusion. It can't get there. Nutrients, oxygen, lymph drainage, getting the toxins out. All of that is compromised when our cardiovascular system is compromised, and blood sugar dysregulation is plaguing 2/3 of our country right now. So we want to see what that is doing, and we want to definitely attack that aggressively.
Question?
Yep.
You said profusion?
Perfusion.
Perfusion, what does that mean?
That's the ability of the blood system to get nutrients and oxygen to the end organs. So perfusion is the blood has everything in it. How does it deliver it? It's the mailman process. Kidney function, blood urea nitrogen. What do we know about it? It says BUN on your labs. Anybody looked at it? Does anybody have their labs with them? I should have brought a sample lab report next time. Blood urea nitrogen is a direct measure of toxins in your bloodstream in the form of urea, nitrogen, that your kidney is not able to filter out because it's overwhelmed and dysfunctional. It is, as a clue, in a normal reference range. If it's rising, I look at trends, right? We're not just looking at a snapshot, I want to see trends every 3 months, every 6 months, every year. What are your values doing? Not just the abnormal ones, what are your normal ones doing? Are they creeping? Are they creeping to unhealthy? Is your blood glucose 80 and then 85 and then 92 and then 99? Is it creeping that we can prevent, or is it stable? Blood urea nitrogen in the aging population is one of those things that I see creeping. The kidneys start to slow down as we age. Actually, after the age of 30, they start to slow down. If this starts creeping, then we get literally toxins in our blood that go to our brain and can cause cognitive decline. I have one patient right now on my roster who's been in stage 3 kidney disease for 10 years, stable as claimed by his neurologist, nothing else we can do for your cognitive decline. We treated his kidney, reversed the damage, and he's starting to see improvement in his memory.
Fantastic.
That's it. Your blood becomes toxic so quick. So when we talk about these detoxifying mechanisms, are you sweating? Are you breathing? Are you peeing? Are you pooping? Are you having sex? Or are you intimate? Are you having those emotional catharsis? There's reasons behind it. Everything ties in together. And I will jump around and around and around and around in our visits, and probably today because I get real excitable. But I hope that I'll always tie it back. And if you get lost in it and say, hey, you didn't tie it back, catch me on it, throw something at me. That's totally fair. But I'll tie it back to why. Because these detox organs directly correlate to how your brain functions. If it's globbed up, if your brain is constipated, it feels the exact same way you do when you're constipated. Ugh, I can't move, I can't think, I'm going through sludge, everything's slow. Yuck, right? It happens.
What do you mean by emotional catharsis? I know what it is, but why are you correlating that to brain health?
Because emotional catharsis, or the ability to process and be in tune with your emotions, actually has been shown in mindfulness studies to reduce inflammation in the body.
Okay, and so cathartic meaning you're going to have an episode of breakthrough or breakdown or both?
All of the above?
Yeah.
I mean, person to person, it depends. So there's studies, it's a really great segue, I can do a quick little tangent here. Has anybody heard the term ACEs? Adverse childhood events. There's a wonderful TED Talk by Nadine Burke-Harris. She's a physician who's saying, why aren't we looking at this? ACEs, adverse childhood events. There's an objective questionnaire to say, how many points do you get? Were your parents divorced? Was there abuse in the home? There's different categories, and you answer how many questions you have. They are showing direct correlation with adverse childhood events or trauma to cardiovascular risk factors. Elevated high sensitivity CRP, elevated lipids, elevated cortisol, elevated inflammation. So when we sit here and say, we know that the Mediterranean diet is correlated with better outcomes with cardiovascular disease, why in the world are we not saying processing childhood trauma is correlated with better outcomes of cardiovascular disease? That's what I mean by emotional catharsis. Different for everybody, but are we addressing these things? In Eastern medicine, I'm not an Eastern medicine provider. I always joke and say I stayed at a Holiday Inn once. No, I precepted with Eastern medicine provider once and just absolutely adored everything that she taught. Couldn't dive into it because it was a whole other degree and I was already pregnant. But the one thing that I remember is that liver qi stagnation. The liver is the organ responsible for anger and betrayal. By the time you reach adulthood, you're pretty much signed up for the anger and betrayal card. Most people have had some sort of trauma, have felt angry, have suppressed anger. Oh, that's not what I'm supposed to do. Anybody over the age of 70 in generational health was raised by the greatest generation. Suck it up, be stoic, deal with it, you got this, right? It's a generational thing, and there's no shame in it. And also your liver suffers from it energetically. And what I tend to see happen is deficient ability to detoxify, elevated liver enzymes. So physiologically, we're seeing in our labs things that correlate with this energetic medicine. I mean, Chinese medicine has it together, man. They don't have the same research that we do, but it works and it's valuable. And I'm seeing the correlation every day in my practice. Emotional catharsis. So things to work on to lower inflammation. Go ahead.
You had mentioned about the bun. What about the creatinine? Isn't that kind of going together?
The ratio,
See
yeah.
that.
So the ratio definitely goes together. It shows us the kidney function. Creatinine as a standalone shows how your kidney is filtering things. We use creatinine as the baseline for filtration. So when you look at the estimated GFR, or glomerular filtration rate, creatinine is the substance that we always have in our bloodstream that the kidney's filtering. And that's how we measure as a baseline of how the filter
So
system
if
works.
it's high, it means it's not good, or if it's too low?
It can. It depends if they measure it in serum or urine. If it's high in the serum, then the filtration is probably low. Or you eat a high animal protein diet. So again, labs are great tools. They're not the end all be all. They could be many different things. But creatinine is also a marker of kidney function.
How does the lab, I mean, if say you know you're gonna have a blood test in a week, and you obviously want to get the true reality of your blood test, but I've seen people say, oh, just eat oatmeal every day, and or do this, don't eat any animal fat.
She really does do that.
No.
I have a lot of patients who do that. comes to blood sugar, I always run an A1C, because then I would say you can't hide the Christmas cookies. Right, that's a 3-month snapshot of what your blood sugar's been doing.
It's okay.
Yeah, so there
So
are
it's
some
not-
labs that we can assess trends of, like an A1C, not just a snapshot. And yeah, I mean, you can trick the system, but then you're not gonna get the help
You're tricking
that
yourself.
you need.
really,
Yep,
yeah,
if it's
okay.
temporary. The other thing I'll say is if you go to get your blood drawn, and it's a fasting lab, fasting does not mean water. I don't want to send my patients back twice to get their blood drawn, but if you come back looking dehydrated, and I can see that in your blood, that also could be X, Y, and Z. I'm gonna send you back for another blood draw to make sure it's not scary X, Y, and Z, and then it's just dehydration, and then you're gonna be mad at me. You're like, oh, I didn't dehydrate, I didn't hydrate myself. So I anchored on BUN, on blood urea nitrogen, but there's a lot of kidney markers, right? I just wanted to give an example of what it's showing us when we see those things. You had a question too?
Yeah, you had said that you can get on YouTube and take that test. What is that test called? So,
ACEs, and it's a TED Talk by Nadine Burke-Harris. And anybody who emails the info, attention Dr. Karen, and you have a question, please do it. I'm pretty good at answering emails. I say pretty good. I'm gonna give myself a 7 on the test. I'll get to it, I will answer it, I just don't know the time
So
frame.
ACEs, how do you spell, is it A, how do you spell it?
ACE,
S?
little s.
Okay.
And it's a TED, this is too low, isn't it? Nadine Burke. And it's a 7-minute video that, if nothing else, is just really enlightening for, family of origin work. If you didn't have childhood trauma yourself, but your partner did, if somebody you know did, it's very enlightening to show how their nervous system has adapted over the course of time. I digress, and we'll get to that. Somebody remind me to come back to that, if you don't mind. All right, liver enzymes. Pretty much status quo, right? If they're high, that's bad, let's look into it. If they continue to be high, that's bad, let's image it. So liver is a tricky one. Liver, I could talk for an hour and a half just on liver, so I won't. But labs for liver are extremely helpful. Even transiently, our liver function tests are AST, ALT, bilirubin, ALK-Phos, different things like that can be transiently elevated. They can also show, hey, you had this inflammation, you had this acute disease. Viral infections will often show up as liver enzyme elevation. It actually just helped me diagnose somebody with COVID because everything else looked fine and she was otherwise healthy, thinking she was having a heart attack. Transient liver enzyme elevation looks like a viral infection, tested negative for everything else, go get tested for COVID. That's the only way it showed up for her, was these liver enzymes. So viruses tend to do that. All viruses. This is not a COVID lecture. Would not have signed up for it if it was. Who would, right? Oh. How many of you get yelled at in your job every day about a virus? Come on. Join the club.
we don't look.
Let me just say this, because I feel like I'm a good person and I want everybody to be a good person. I think that you probably are. Don't yell at anybody. This is a tough, tough, unprecedented time in our lives. Every single one of us, unless you were alive in 1918. No one's ever done this before. Don't be mean.
Kind to everyone.
Do your best. Frustrated, that's a good emotion, but yeah, be kind. HSCRP. How many people have gotten an HSCRP? High sensitivity C-reactive protein. C-reactive protein is a protein that your liver makes when it's in distress. Help! Something's wrong. What's wrong? I don't know. Not much help, right? High sensitivity CRP tells us that it's inflammation in the cardiovascular system. Help! Something's wrong. What's wrong? I don't know, but it's something in the cardiovascular system. What is it? I don't know. These are the questions I have with my lab reports, just in case you're wondering. Gives us a little bit more information. HSCRP can also be elevated not just with cardiovascular disease, but periodontal disease and subclinical UTIs. In the aging population, subclinical UTIs are a very common reason for cognitive decline. Help, my great aunt, she's not thinking clearly. She's got to go to home. She went to go see a neurologist. Nothing they can do for her. Cool, did they test her urine? No. Let's take a look. She's 73. She's got back pain. She's 73. Of course she's got back pain. She goes to the bathroom all the time. She has diabetes. Of course she goes to the bathroom all the time. She has diabetes. She's old. She had 6 kids. She's going to go to the bathroom all the time. Test the urine. Ask for a urine test. When you go to see your doctor, by the way, you can ask for labs. Hey, can you test this? Went and saw a talk by this crazy witch doctor, Dr. Karin over there at Pilgrims. She said this might be important for me to look at my risk factors for cardiovascular disease. Let's get a baseline. Let's see what's going on. Can I see what my kidney function is? Can I see if I have inflammation in my body? Inflammation is so non-specific. It's my favorite and least favorite lab of all time. I tell a patient, you're inflamed. What do they say back? Duh. I came here to tell you I was inflamed. I don't feel well. I have symptoms of inflammation. You're telling me I'm inflamed. Great. But now we can monitor your status. Are the things that we're doing working? What affects you and your individual physiology? How is this pertinent to your body? HSCRP, I love it. I love it in my aging population because periodontal disease and subclinical UTIs are so common. When's the last time you saw the dentist? Well, it was COVID, so it's been a couple of years. Get your butt back in there.
That's a blood test or a urine test?
It's a blood test.
It's a blood test.
The inflammation, for testing inflammation is a blood test?
That's a blood test, yep. HSCRP comes out in your blood. So everything right now is blood. And then I'll stop for a moment and then we'll go on to different sourcing. That'll help. But dentist is important. I will also tell you, if you ask me about dental health, I will say, go see your dentist. It's a specialty.
And it's not hard just because there's COVID around. Dentists are very.
It was last year. It was very hard for patients to get into their
We
dentist.
went twice last year.
Wow, you are getting gold stars all around today. I love it. You're doing great. Homocysteine. Who's heard of homocysteine?
Who's what?
Who has heard of homocysteine?
I've heard of it.
Yeah.
I don't remember what it is.
Good. The bandit? Do you know what it is? Can I call you the bandit? Okay. You are as stoic as they come. I like it. You're my target audience right now because I just want to get one little smile. Call you the bandit. Homocysteine is a byproduct of methionine metabolism. None of that matters, right? Those are all a bunch of biochemical words. B6, B12, and folate deficiencies can cause a halt in that metabolism, increasing the homocysteine levels in the blood. The normal reference range for homocysteine on your labs is 0 to 14. Guess at which range it becomes neurotoxic. Hint, it's less than 14. It's 11. Homocysteine and B12, here's a little picture. Obviously this is well loved and well used in my office. Elevated homocysteine can come because of all these different reasons. Folic acid deficiency, B12 deficiency, B6 deficiency, and betaine deficiency. What causes these? MTHFR, polymorphism, that's a genetic polymorphism that doesn't allow you to methylate your B12 effectively to then be used in further biochemical reactions. Levodopa use, if you're somebody with Parkinson's and you're on the medication with levodopa, or you've been prescribed levodopa for a mood disorder, which isn't all that uncommon anymore, depletes your body. Being elderly, I don't want to make assumptions, but I'm not blind. We've got how many? It was 65? Anybody meet 65 here? Yeah. B12 deficiency, malnutrition, alcohol use. The other thing I want to add in there, autoimmune disease. If anybody has been diagnosed with an autoimmune disease, it begets other autoimmune diseases. A common autoimmune disease is intrinsic factor. Intrinsic factor is the little factor in our absorption that we need to get the B12 after we absorb it in the small intestine and then carry it to then be absorbed into the bloodstream. If we have autoimmune against that little courier, we could take all of the oral B12 that we want and not get any benefit. The other thing that happens, sorry to report, is that as we age, our absorption goes down. Our small intestine gets weary. B12 is a big molecule. So these things all combine to get into deficiency. Other thing not listed there again is metformin use. Metformin is the common first-line therapeutic for people with type 2 diabetes. It deprives your body of B12. People with diabetes often suffer from depression and cognitive decline before age-matched controls in their population, often linked to the cardiovascular disease risk factors of being hyperglycemic, without any cause to say you have B12 deficiency just by inherent use of this medication we prescribed to you 30 years ago.
So, my doctor just told me that I need to take methylated B12, B vitamins. But, so she has me take a BMG,
Okay?
5 minutes before I take my B vitamin.
Okay.
And then it carries it.
Yep.
The way it's supposed to go.
And you can do that without doing the genetic test. When I look at B12 levels, just for the record, and here is something you can ask for. B12 levels in the blood, what does that mean? I just told you all the steps that it has to go through, right? So let's think critically. If I test the B12 in your blood, what barriers did that pass to get there? You took it, right? You absorbed it. Your intrinsic factor was made and then brought it down for absorption, and it got into the blood, right? That's all it tells me. You have B12 in your blood. Are you using it? I don't know. Did you pee it out? I don't know. It doesn't give me information. Methylmalonic acid is a byproduct of B12 metabolism. You can measure that in your serum in your blood. And on every medical paper out there, it says it will find a B12 deficiency before serum B12 levels do. And how many doctors push back on me when I say, please run an MMA on Sarah because I think she has a B12 deficiency. No, her serum was fine. Cool. This will show if it's deficient before your serum, and we want to catch it on the front end. The other lab that I run is homocysteine. If you're taking B12 and you're not able to methylate it to then use in further biochemical reactions, your homocysteine will still be elevated for no other reason than to say you're not actually able to use this version of B12. And then we put you on a methylated one, and lo and behold, homocysteine comes down.
Are there symptoms that you get when your homocysteine level is low? Is it just tiredness and?
Tired, tremors, anxiety, neuropathy, cognitive decline.
Oh, it's a lot, okay.
How many of those overlap with neurologic disorders? Lots.
Can you explain neuropathy?
Yep, neuropathy is a decrease in function of your nerves, your peripheral nerves. So it could be numbness and tingling, it could be pain, it could be burning sensation, it could be loss of what we call proprioception or your wherewithal in the universe. So really neuropathy is a disease of the peripheral nervous system. Sorry, I should have said that earlier. Told you I'm excitable. Thank you for stopping me. So at a level of 11, homocysteine becomes neurotoxic in the brain.
So question.
Yes.
Why then do they say that it's, the levels go from 0 to 14? If at 11,
Good question.
we're hitting a toxic.
I wish I knew.
Okay.
Yeah, it's a really good
Just wanted
question.
to make sure.
No, I know, it's a really good question, and I love that you asked it and that you caught it, and I wish I knew. I don't. It kind of brings us back to the reference ranges. How are they making those? In people with Parkinson's disease, because that's where I have my control data, and I will always say this is the limitations of what I know, but an elevated homocysteine leads to progression of Parkinson's disease, dementia, and depression higher than controls in the population.
So can you control that cysteine, whatever you said?
Yep. So those 4 nutrients that when they're deficient cause an elevation, we supplement with those and make sure that everything else is working for the absorption, metabolism, and biochemical reactions, use of them, and we see them drop, and I see them drop in 3 months. Start supplementation, it drops, start to see movement. Lipids. What do we know about lipids? What are the lipids? Cholesterol, good and bad, triglycerides. Those are really what we're looking at. There's a lot of information out there about cholesterol. Not a lot of information that says your brain is made out of it. Yay, cholesterol!
We need it.
Yes, the lipid membrane around your neurons are made out of cholesterol. When that starts to disintegrate, the electrical conduction between synapses, or how those neurons communicate with each other, is compromised. It can cause neuropathy. It can cause cognitive decline, slowness, vision changes, brain fog, you name it. Slow gastric transit time, right? All of these things, the nerves are everywhere. They're omnipotent, the nervous system. I love the nervous system, obviously. Made out of cholesterol. What's the levels that you say you want to have, right? We want to be low cholesterol. My doc wants me to be low. Bring it down, bring it down, bring it down. Yeah, but down to what? How low do you want to go?
Well, they say 200 is
300.
Yep, 200 is max for total cholesterol. What were you going to say, Bandit?
Mine has been 305.
And our doctor says it's okay.
Okay, I'm not here to argue with doctors. I have thoughts about that, but I'm not going to argue them here.
Well, what's your thought?
I'm not going to argue them here. I'm not here to do any individual medical advice. What I will say is that I want at least 175 for anybody with neurologic complaints for their total cholesterol. I want to see the HDL above 60. Good cholesterol. I want to see the LDL below 100.
I'm sorry, would you say that again? The HDL needs to be what?
60.
60? 60?
60.
Okay, and
Above
then
60.
the LDL
Under 100.
under,
100.
oh, okay.
Yep. Total 175.
Can you repeat that? I'm writing wrong.
Sure, that's okay. Total TO 175 to 200. HDL over 60. LDL below 100. Now, some people who have high cholesterol, stable, long term, I will say, how big of a risk is your high cholesterol? Is your HDL high and your LDL high? Or is your HDL high and your LDL low? There are further risk stratifications you can get into for your cholesterol profile to see, do you have the big fluffies or do you have the small pellets? Small pellets go ping pong off your vascular system and cause damage, right? Big fluffies are exactly what you think, little marshmallow cholesterol floating down your vascular system. Bump. Okay, we can take that, right? So there is further risk stratification if you have chronically high cholesterol. Big takeaway is we do have goals, and I do have specific goals in those normal reference ranges for people with neurologic conditions. If you're complaining of neurologic conditions and your cholesterol is below 175, we're boosting that puppy. Sound good?
Boosting the HDL or both?
I'm going to look at your total cholesterol and we're going to focus on HDL. Yep, ideally. A1C, we talked about A1C. Hemoglobin A1C is a 3-month snapshot of what your blood sugar's been doing. As always, there's a caveat, right? We want to see, you can't hide the Christmas cookies. That's always my joke with people. Good luck. You can eat oatmeal for a week, but you can't hide what you did the week before. Now, anemia is a chronic issue in our aging population. Slow bleeding ulcers, different blood clotting disorders, low meat intake, low absorption of iron, da-da-da-da. Anemia happens, right? If you have a low red blood cell count and you have a high normal A1C, you probably are either pre-diabetic or diabetic. The A1C is directly dependent on how many red blood cells you have. If they're low, then your A1C is falsely low, and it needs to be addressed. Again, I've seen it so many times in lab values where you're fine, your blood sugar is 99, your A1C is 5.5, you're anemic. Okay, well your A1C is probably not 5.5 and above 5.7, you're pre-diabetic. And now we've got sticky little gremlins in our cardiovascular system causing issues with our neurologic health, and Dr. So-and-so wants to put you in home, right? There are consequences to misreading these labs, big ones.
Could you explain what A1C is again?
Yep, it's a 3-month snapshot of the blood sugar in your bloodstream.
Oh, the blood?
Yep. So, big words to small words. Glycosylation of red blood cells is what an A1C is. Glycosylation means how much sugar is sticking to your red blood cells. Red blood cells only live for 3 months. So when we take your A1C, we know that whatever that level is has only been around for 3 months because that's only as long as those red blood cells have been alive. How sticky are they? Shows your average stickiness or blood sugar value over 3 months. If you don't have many red blood cells, it's going to show up as low.
What do you want? What level do you want? Low level?
Of red blood cells or A1C?
A1C.
With a normal level. So some people can be too low and have hypoglycemia is not effective either. We like blood sugar, but I say between 4.8 and 5.5 would be great for a fasting blood sugar. And I'm actually proud of myself, it's 7 p.m., I remembered that. Iron. Necessary and damaging. Iron is the most gray, walk the line, how do we want this to be nutrient that I see all the time. We need it, it's helpful, we don't want anemia, we want to have all the beneficial properties of iron. But given too much power, iron is another gremlin. It causes oxidative stress, it kills cells, it free radicals, creates free radicals, which are highly damaging to the cellular process. So iron is definitely one that we want to stay on the fine line. And there's other values around iron. It's UIBC, TIBC, transparent. If you've ever looked at your labs, those all give a big picture of how much iron do you have, how much iron is in your bloodstream, how well does iron get bound to its carrier protein, and how well does it get released from its carrier protein. All important values to look at. I always think of those values as the bus. How many kids are riding on the bus? That's your iron. How many seats are on the bus? That's how much iron you're willing to hold. And then how many seat belts are on the bus to hold those kids on there until you get to your destination. So what is the strength of that bind to get the iron to where it needs to go? If iron in your blood is your checking account, you take it, you absorb it, it gets in your bloodstream, then ferritin is the savings account. How much ferritin you have is an indication of how much reserve iron you have in your blood. Oftentimes, we'll see the ferritin get too low before we see an iron deficiency anemia. You're depleting your savings account, it's just bleeding out behind you before you spend all your money. But that's bound to go away soon and you're starting to see the symptoms of anemia. A really great preventive tool when you're reading labs to prevent the symptoms from showing up. Hey, I see you don't have any savings left. Let's boost that so you don't have the symptoms. Ferritin is also what we call an acute phase reactant. It's something that's made in the liver. It's a protein that's made in the liver for the purpose of iron storage. It's also made in the liver when it's under distress. Why? I don't know. But it helps tell me if you're inflamed. It's another marker to show inflammation in the body. There is a genetic condition, I mentioned it earlier, called hemochromatosis. That is an ability to absorb too much iron, iron overload. Ferrin is too high, ferritin is too high, and it can cause multi-organ distress. Heart failure, pancreatic failure, insulin resistance. A lot of these different metabolic symptoms that we're seeing in our standard American diet people, when you back up and zoom out and see all of these are happening at once and we don't really know why, request an iron panel, get a baseline, see where you're at. For postmenopausal women, it's usually not diagnosed until after menopause because every month you're bloodletting. So you're not going to have a buildup of iron. You're naturally giving phlebotomy every month. Men, it's usually diagnosed early because you're not. So definitely a very valuable resource is your iron. We already talked about B12. Uric acid is an interesting one. We always associate uric acid with gout, right? Inflammatory marker for gout with too much uric acid. Uric acid is actually protective. It's a really potent central nervous system antioxidant. People who have osteoarthritis or a history of gout, I typically see this in my male patients who I like to drink beer and eat meat, and that's what I do. And now I'm having neurologic issues, and my doctor told me not to do those things, and I checked their uric acid, and it is bottomed out. And I say, let's get that up a little bit. We want to balance it. We don't want too much, but it's a very potent antioxidant in the central nervous system. Omega check. Check your fatty acids, right? You like omega-3s? Here's what I'll say about the supplement industry. If you are taking a fish oil, please take a fish oil. Let's just say that. It's so great. Unless you're on a blood thinner, right? I'm not here to give medical advice. If you're on a blood thinner, if you have a coagulation disorder, don't. If you're allergic to fish, don't, right? Don't take it just because I said it in a talk. But it's a great supplement for a lot of people.
How do you deal with all the contamination of fish?
Sustainable sourcing. So there are only a few, fill in the blank here, brand names, yep, that I trust for sustainable sourcing, wild caught fish. And you can get, I mean, there's always going to be the risk, again, in moderation. When you're looking at your fish oil label, it's going to say on the front, heart healthy omega-3s, 1,000 milligrams of omega-3s. And then you turn around in the back and you look at EPA and DHA and you add them together and it's 600. Where in the world did they get the rest of them? I don't know, don't ask, don't care. I want to know what the EPA plus DHA is. That's it, bottom line. You want to argue with me? You can. I can't back it all up. It's somewhere in the research. I didn't memorize it all, but I will tell you those are the only things I'm looking at when I'm dosing it, because that's where the research shows for its anti-inflammatory, antioxidant, triglycerides. There's so many health benefits of a good, strong dosing of fish oil. If you have a neurologic condition, I'm going to do a high DHA fish oil, because that's the fatty acid that has the affinity for the nervous system, for your neurons. Again, those membranes are made out of fat, cholesterol. It needs that padding and cushioning, so the high DHA is where we're going. I'm talking gram dosing, not 1,000 milligrams, not 800 milligrams. I'm talking 4 to 6 grams per day. So when you're choosing a fish oil and it says 600 milligrams, you're like, oh, okay, I can take 4 of these a day. And then you see the serving size is 3 capsules.
Uh-oh.
Oh, and how big are those puppies? They're like that big around, right? Talk to your doctor.
That's a question.
We have
So,
tools.
when you say 4 to 6 grams, are you talking DHA specifically or the combination?
The combination. Yeah. If it's high DHA, then I want to see a higher level in the ratio.
But that's only if somebody has neurological issues.
Mhm.
For an average, you wouldn't take that much, would they?
Not necessarily.
Not necessarily?
Depends on your symptoms.
Yeah.
Other places that I would dose high osteoarthritis, fatty liver disease, high triglycerides. So.
To that degree, to that amount again, to that 4 to...
Yep, it's going to depend, right? Each individual gets their own dosing, but yeah. High dosing, therapeutic dosing.
So if we come and see you and you determine that we do need the higher elevation of the DHA, do you have that there?
Mhm.
Oh, okay.
Vitamin D. I mean, I feel like I can skip vitamin D, right? Like turn on any news station and they're saying, vitamin D. It's like the world just found out about this secret that we had and we've known it all along. Take your vitamin D. Here's the thing that I'm going to say that I say most often. You can get toxic in vitamin D. Did anybody know that?
Yes.
It is a fat-soluble vitamin. It gets stored. It can create toxicity. It can mess with your parathyroid hormone, which in math messes with your calcium balance in your blood. Right? We don't want to do that. Calcium is a nasty little bugger if it's not used correctly. So, vitamin D. Take it. Love it. DH.
But
Okay.
there's a difference between D3, D2 and 3 and 5 and,
Yep.
yeah,
Talk to your doctor.
okay.
Because there's kidney health, there's parathyroid health, there's a lot of different things that go into prescribing vitamin D. That's what I'm saying. I mean, rewind, right? Like, supplements are not benign. Just because it's natural does not mean it's safe. Just because Jimmy Joe over here took it and it cured their cancer does not mean it's going to work for you. Just don't. How's that? DHEA, the spunk and vitality hormone. Who wants that?
Yay.
I'm a mother of a toddler. I could use some spunk and vitality, just direct shot, right? Anybody else? Yeah? A little boost? Postmenopausal women often see a sharp decline in DHEA. As you lose your balance of hormones, this one drops out as well. DHEA is extremely neuroprotective. We also see that in all of our aging population. Reference ranges for DHEA are based on who? Yeah. Got it. You guys got it. That's it. Test your DHEA. Check it out. If you have a hormone-dependent cancer or a history of or a strong risk for, it would be contraindicated for you. Moving on to urine. We already talked about urinalysis. We want to do that. F2 isoprostanes. Big word. Really, it's telling me how rancid are you? How much oxidative stress is in your body? Really helpful to determine how much oxidative support do you need.
So it's a separate test from the urinalysis?
Yep.
And what was that test called again?
F2 isoprostanes.
What's that last word you're saying?
Prostane. P-R-O-S. Rancid. Thank you. Studies have shown that 6 months of a Mediterranean diet, supplementing CoQ10, melatonin, NAC, antioxidants, and omega-3s can lower it. Can be done. Lithium. What do we use lithium for? Mood. Mood. What kind of mood? Bad mood. Yeah. What kind of bad mood?
Manic depressive.
Stereotypically used for bipolar disorder 1. Stigma against taking lithium because that's what it's dosed for at super physiologic doses, pharmaceutical doses, is for manic depressive. There are studies upon studies since the 1980s saying we need to lithiumate our water just like we fluorinated it. Our earth is becoming depleted of its minerals. Period. Dot. End of sentence. That includes all of the minerals. Lithium is an important cofactor in BDNF, brain-derived neurotropic factor. You have to write all this down. What does that mean? How do we grow new neurons? Brain-derived neurotropic factor. We want to grow new ones. I want to keep it sharp. I want to learn how to dance. I want to learn to play piano. I want to learn guitar. I retired. I get to do all these things I want to do, and I can't think, damn it. I can't learn it. I can't get it. They just came out with a new computer. Why can't I get it? How are you going to grow new neurons? You need the biochemical cofactors to do it, and our earth is becoming depleted. Lithium is a really, really great and easy supplement, appropriately dosed at a physiologic level, not a pharmaceutical level, to support mood. Also, in people with Parkinson's, it's been shown to slow depression, dystonia, which is painful cramping. My mentor once told me that she lithiumated her children, her teenage children's milk in their cereal and noticed a difference in their mood within a week. So I don't think we can publish that study, but I appreciate the anecdote.
Well, isn't lithium just a salt we're missing?
It's a mineral. And again, that's why I said the earth, and when we say the earth is depleted of our minerals, the soil, and therefore our food is depleted, people want to just handpick the ones that it's getting depleted of and say, oh, take these. It's really just a very short sentence. It's deplete. So, stool tests. Best for last. Who's heard of SIBO, small intestinal bacterial overgrowth? Dysbiosis? Leaky gut. Who's been told they have leaky gut? Everybody's been diagnosed with leaky gut via the internet.
What is it?
Leaky gut is when we have increased intestinal permeability. Our tube from mouth to anus is a closed system, supposed to be. We selectively absorb the nutrients that match the receptors and bring it through into our bloodstream as needed. Brilliant engineer, right? That did this. When it becomes leaky, when it becomes inflamed, when there's damage, food sensitivities, food poisoning, poor food choices, trauma to the area, stress, anything that causes inflammation in the body causes those junctions, which are tight junctions, to loosen up a little bit. Bigger particles can get through and your immune system says, hey, that's foreign. You look like a pathogen, I'm going to attack you. Local inflammation comes in, your immune system's trying to do what's right. and it causes further destruction of the intestinal wall.
So how do you know what you can have it?
Multiple symptoms: indigestion, nausea, bloating, gas, constipation, or diarrhea. There are a lot of different ways to think that, hey, I may have leaky gut. The big thing that I see in lab values is we do a food sensitivity test. I have all these GI issues, I can't figure out what's happening. Cool, let's test your food sensitivities, and everything comes back positive. Chances are you're not reacting to everything you eat. It's that everything you eat is causing a reaction. It's leaking through. It's been associated with a lot of full body issues,
So
urinary tract
if
infections.
you think you have it and you want to get rid of it, what do you do?
Different things that you can do for leaky gut or dysbiosis is you can do an elimination rechallenge diet. Is eliminating foods that we think are causing havoc. We can do a food sensitivity test to see if we can narrow down which items are happening. And then there are certain nutrients that help repair that intestinal walls, like glutamine and zinc.
What happens to your intestinal walls?
Those cells break apart. So the actual cell stays together, but the junction where they meet is supposed to be tight. It's supposed to have a good bouncer there that doesn't let anybody through unless they have a pass. And they start opening up and it becomes leaky.
And what
And then
happens?
these nutrients can pull it back together.
Okay,
heal
but
it.
they get leaky.
Mhm.
What does that mean? What comes out of it?
So the food particles that we're supposed to digest or absorb
That's
once
what I
they're
thought,
broken
yeah.
down are bigger in size and they can actually fit through there before they're broken down effectively. Yep. So you have a heightened immune response to food particles because your body thinks that it's foreign. So there are nutrients that can bring it back together. Other things that I prescribe with leaky gut is let's slow down on how much foods that we're eating that cause a lot of digestive energy. Kind of going to a broth fasting, cook down vegetables, avoiding raw foods, right? All of these things that take a lot of energy and work for our body to digest. It's like cool it for a minute and give it some time to heal. Let's repair the immune system with either a probiotic or if there's dysbiosis, if there's bad bacteria in your gut, let's kill it, as long as you're pooping. I'm not in the business of killing bacteria and not having to poop that out, right? I just bleeped myself. So if you're going to kill it, it's going to release toxins and can cause worse symptoms. So you have to be pooping if you're going to take an antimicrobial.
Have you heard of Dr. Stephen Gundry?
I do.
And I have his tapes and everything at home, and I have a friend who has lost 40 pounds. And you know what? I showed her the tapes and everything, and she just eats like she always has. She doesn't, and she's waiting to get an appointment with a specialist in Seattle,
Okay.
and they're still waiting.
She's in Seattle. She's open to seeing a GI specialist, naturopath. I have a referral for her. You can email me and I'll send you her name.
Okay.
She's phenomenal. She focuses on the gut. She's amazing. Leaky gut in the brain, right? Let's not forget why we're here. Talk about poop in the brain. We already talked about toxin buildup, right? And how that affects the brain. Your poop is a huge way that we eliminate toxins. Your bowels are another way that we eliminate hormones. We support our liver through that process. If we don't eliminate them, they get recirculated through the system and cause imbalance. Thyroid, testosterone, estrogen, progesterone, all these imbalances that we see in our hormones these days, a lot of it has to do with your digestive system. Are you eliminating your toxins? Are you getting rid of the byproducts of your body's metabolism? The other thing that we've seen is leaky gut correlating with a longer recovery time from traumatic brain injury and concussion. That inflammation, we have a nerve, we have a highway, we have a direct route from our gut to our brain. It's called the vagus nerve. Heard of it? Not like let's party in Vegas, but VAGUS. It's responsible for the parasympathetic nervous system, rest, digest, restore, and heal. There's 4 words to that. You know that? Rest, digest, restore, heal. Sympathetic nervous system. What are those words? Fight, flight, fear, freeze, or fawn. Fawn. Who fawns?
So it was what?
Fight, flight, freeze, or fawn.
What is
You're going to fawn by a grizzly bear, right? What are you supposed to do? Play dead. Some people, when they get stressed out and you know the type, right? Deflate. Done. I'm just gonna play dead. This doesn't exist. Hey, Mary, we're in a pandemic. No, we're not. I'm not watching the news. I don't know. I'm falling, playing dead. Right? Some people freeze during the headlights. Stuck. Now I'm stuck. I can't move. Stuck. I can't make a decision. Hey, where do you want to eat tonight, Dennis? I don't know. Don't ask me any questions. Stuck. I'm going to talk about that in a minute. Gut health. I can't say enough about it. We have study upon study, again, conventional medicine, right? Let's replace our poop. Let's do a fecal transplant. Anybody heard of that research? It's amazing. MS, huge research behind fecal transplants and outcomes in MS. You have that poor of dysbiosis, that imbalance of bacteria. You're going to take your poop out and you're going to give somebody else's poop. Phenomenal, phenomenal research. Why can't we address this health earlier? That's my question, right? Here's my magic wand. Wish I could do it. But that's the importance of it. And I say that because not because I want to give fecal transplants to everybody, but if I can tell somebody who has this disease, here's a neurologic condition, here's MS, here's Parkinson's, and say, this is a huge factor in your symptom severity and your quality of life, and they start to say poo-poo, pun intended, I'm going to say this is what they're doing. They're giving you somebody else's poo because it has such a huge impact on the severity of your disease. Do you want somebody else's poo? No. Cool, let's work on yours. Let's fix your poo. Let's get it right. There's so many tools in doing that, and it's super effective. There are theories upon theories in Alzheimer's, Parkinson's, ALS, MS, chronic neurological conditions that say, I've had food poisoning, I've had a traumatic brain injury, where I was constipated afterwards. I have chronic constipation. I was diagnosed with IBS at 12 and never treated, right? IBS is a diagnosis of exclusion. What does that mean in fancy medical language? We don't know. It's not anything else. So it's IBS. IBS is not a diagnosis. It's a diagnosis of exclusion. So, if somebody's not giving you answers and you're not feeling better, find somebody else. Keep looking. Keep advocating. The fight is hard. I get it. Keep doing it. Sleep apnea, insomnia, and snoring. I'm going to package those together. Sleep disturbance. If you haven't, you need to get it fixed. If you're resistant to going to a sleep specialist, I'm running out of time, so I'm going to say get over that shit. Because here's why. I didn't censor myself there. It can be scary. It can feel traumatizing to have to wear a Darth Vader mask. The research out there of the implications of chronic sleep apnea with cardiovascular disease, neurological diseases, on and on and on, metabolic dysfunction, are overwhelming. It is time that we embrace this as a foundation of health, just like ACEs, just like the Mediterranean diet, just like everything else that we're trained to do is a huge component to our health. There's also new studies out, they're not new anymore, actually, I think 5 or 6 years old, that say our brain has its own lymphatic system. It's called the glymphatic system.
Wow.
Ooh, it's fancy. And when does it turn on? When we're sleeping. You flush the toilet of your brain when you're asleep. That's it. You don't do it? What's in your toilet when you don't flush? These things they're there, and it's just this phenomenal, marvelous universe of physiology up there that we're still learning about. And as we learn it, I wish I could project it and, say it loud. For people back, if you're snoring, chances are you have sleep apnea. It's a huge correlation. There's also something called central sleep apnea. You could not be snoring. You could be fit as a fiddle and say, I don't have the overweight that causes sleep apnea. Anybody been pregnant and get sleep apnea just during pregnancy or start snoring just when the belly is like trying to find a place to go when you're laying down? That can be transient. There's also sleep apnea. There's different versions of sleep apnea that a sleep specialist can help diagnose. Central sleep apnea is found in, wait for it, 100% of people with Parkinson's. 100%. Either when they're alive or on autopsy, they're showing this person has central sleep apnea. It is a lack of oxygen to the brain. which causes you to disrupt your sleep cycle. Wake up, your brain is starving. Insomnia, also starving the brain. I'm going to be very transparent and on film and say if somebody comes to me and say I have sleep disturbance inside, I cry a little bit. It is so hard to figure out why you have sleep disturbance. Doesn't mean I'm not going to try, but it's hard. And I will be very upfront with you to say it's trial and error. What's waking you up? What's making it hard to fall asleep? What's going on in your life? What's your environment like? Do you have toxic exposure? Are you in an abusive home? What's going on in your personal life? What's your diet like? What's your nighttime routine? How do you feel when you wake up in the morning? What's your thyroid doing, right? Again, hour and a half I could spend on insomnia. So there's a little part of me that cries inside and somebody's like, I have trouble sleeping. Help me. Okay. Buckle up. We're going on for a ride. But it is so important that it never falls out of any visit that you're going to get in. Nutrients, we kind of hit on that. We have to have good absorption to get our nutrients. Digestion, so the whole adage, you are what you eat, throw it out the window. You're not what you eat. You are what you eat, what you absorb, what you digest, what you metabolize, what you perfuse, and what you receive. There are so many veers and changes in the road to get the nutrients to where they need to go, that it's not just what you eat, it's how you eat. The cephalic phase of digestion goes in every single visit summary that I send to anybody that comes to see me. How do you eat? Like this? I'm snacking during a presentation, I'm working, I'm doing this, I'm watching my grandkids and I'm trying to shove something in my face at the same time. Did you smell your food? Smelling your food creates the digestive enzymes in your saliva that break down sugar. When you swallow that saliva, it triggers your stomach to release hydrochloric acid from your parietal cells. The hydrochloric acid then breaks apart pepsinogen into pepsin to break down proteins in your stomach. Those need to be broken down to then be released in the small intestine and absorbed. And to tell your gallbladder and your pancreas, hey, squeeze, here comes some food. Squeeze it and emulsify it. Then we start digesting and packaging and sending things to the colon for the bacteria to then keep munching on and digesting and absorbing water. And then we send it out. Did you smell your food? If not, you're dumping that into an empty vessel and saying, go. And then a day later, you're like, why have you not come out yet? What's happening back there? It hurts. Smell your food.
That's why I had my children and my grandchildren on the counter as I was cooking so they could be smelling.
Yep.
And even tasting, and they loved it.
And what do you think, great segue, what do you think their memories are going to be triggered by? Aroma, smell.
Yeah.
When we're talking about memory loss, your smell is the only sense that goes directly to your brain. Right to it. Smell it. Remember grandma's cooking. Right? Remember where you were on your anniversary. Remember where you were when you found out your husband passed away.
Yeah.
Those emotions are tied to something in your brain. That's the physiology. They're all there together.
And not only do they remember grandma's cooking, they know how to cook because they remember the smell.
That can be helpful. We didn't get to COVID and the blood-brain barrier. In short, I will say there's a lot of long hauling out there with brain fog and memory issues. I'm seeing a ton of it as a neurologic focused person. Each person's going to be a little different because these viral infections affect everybody different. I'm going to say these viral infections because take COVID out of it, this virus is acting exactly as a virus acts. It's doing as exactly what we would expect a virus to do. It's severe, and it's communicable, and it's scary, and it's still a virus, and it's doing exactly what we would expect it to do. We have a lot of things that we can do to defend ourselves against it, and it's also causing a lot of chaos. Long hauler syndrome is not foreign to the people in the naturopathic community. I diagnosed EBV, Epstein-Barr virus, latent mononucleosis reactivation, right? CMV, herpes. There's a lot of viral infections that come back in times of stress. I'm diagnosing it all the time because it's not being caught in other doctors' offices. This is what viruses do. They come in, they hide, they're smart, smarter than us, they're opportunistic. they're gonna pounce. So that's about as far in depth as I wanna get on that. That's okay, and I can stay after and chat with you if you have a more specific question. Restless leg syndrome, that's another huge, broad topic. Essentially, that's when during wind down time in the body, the muscles and the nerves become hyperactivated in your body, and the only way to calm them down is to get up and move, which can be counterproductive to sleep. There are a lot of nutrients that we look into for restless legs, all of your electrolytes, magnesium, and then we look into stress levels. I'm going to stop my lecture part at the following. Everything that I've said and everything that we've talked about is dependent on one huge part of your neurologic system. Anybody have a guess on what that is? We touched on it earlier. Your autonomic nervous system. Are you in fight or flight? Or are you in rest and digest? The best part about that balance is you can only be in one or the other. You can't be in both, and you can't just dip your toe in. I might jog away from this bear, right? I'm gonna kind of rest. Doesn't exist. You are either fully in one or you're fully in the other. Every passive breath we take by design, inhale puts us in sympathetic nervous system, exhale puts us in parasympathetic nervous system. We trigger that vagus nerve every time we exhale. So with passive breathing, our body is this beautiful teeter-totter, right? Variability, we're looking for variability. What's resilience made out of? Rubber, right? We're flexible, we're adaptable, we can see when threats are coming. We're not just in steady state like glass. You get hit, shatter. We want variability. Heart rate variability is gaining a lot more credibility in the medical world, and it's important. We want it to increase a little bit when we inhale. We want it to decrease a little bit when we exhale. The problem is, how many of you have been on a trampoline? Right? Here's the exercise. Are you guys ready to stand up and move a little bit? Play along, won't you? So everybody sit. Right now. You're sitting right now. You're staying sitting. Close your eyes. Everybody close your eyes. It only works if you close them. You wake up in the morning. What's the first stressor? Somebody yell it out. First stress in the morning.
Alarm clock.
Alarm clock. Two of you stand up. Here, you stand up, and you stand up. Good. Okay, it's 10 a.m. What's the next stress of the day?
Breakfast?
Oh, you guys can't talk. You're standing up.
We're already
Yeah.
alive.
What's the next stress of the day at 10?
What to make for dinner?
Okay, what's another one?
Work.
Stand up. You stand up. All right, it's noon.
Stand up.
What's your next stress?
What to eat for lunch?
Yeah. Okay, you stand up. What's another stressor?
Work.
Go ahead, stand up. Everybody who's standing up, start wiggling. What's another stressor? It's 5 p.m. Dinner. Oh man, how many people are stressed about dinner? Go ahead and stand up.
The drive home.
Stand up. All right.
This feels kind of natural.
Yeah, keep wiggling, keep wiggling. What other stressors do we have? Those of you who are sitting, shout one out. If you're standing up, you don't get to sit anymore. Or you don't get to, so keep wiggling if you're standing. Those of you who are sitting, what are your stressors?
Nightly news.
Driving
Nightly news. Raise your hand, wiggle it out.
Driving truck.
Raise your hand, wiggle it out. Bandit? Finances, relationships.
Oh, there you go.
Stand up, wiggle it out. Wiggle those hands. How many of you between 8 a.m. and 5 p.m. took a deep breath in between each of those stressors? How many of you calmed down and took a nap? How many of you meditated? Look around the room. That's what your nervous system is doing. You're getting ready to go to bed and here's where you're at.
Yeah.
Right? When we don't calm it down, go ahead and sit down if you want. When we don't calm it down, we're on this trampoline all day, and if you've been on a trampoline, the longer you jump on it, the higher you get, right? The longer you're on it, bounce, and one more thing, and bounce, and traffic, one more thing, and then my daughter called, one more thing, and then finances, we just had to pay this bill, one more thing. These things build up throughout the day, and if we don't stop, what happens when we stop on a trampoline? It takes a while to get back up to where we were, right? You can't just start bouncing bouncing again and be like sky high. Our nervous system works the same way. If you don't press pause, if you don't intentionally bring it back to the other direction, all of that is cumulative. And then you come to me and you say, Dr. Karin, I'm having trouble sleeping. I don't know why. What are you thinking about? Breakfast, lunch, dinner, my relationships, my finances, what am I going to do when I retire? Who's going to take care of me when I have to go into home because my doctor said I have memory loss and there's nothing they can do? And oh yeah, there's a pandemic and political disarray and Afghanistan's a mess. We can fawn all we want, but the world is still there. And when we ignore it and we don't lean into the fact that our bodies need care and they need rest and they need intentional rest. They don't need timeouts, they don't need avoidance. They need intentional rest and care. That nervous system causes none of these things to work. You're not going to absorb your food because you need to be in rest and digest to digest your food. You're not going to remember anything because when we're in sympathetic nervous system, the blood vessels at the back of our brain actually dilate and the ones at the front constrict. The front is your prefrontal cortex. What's my logical thinking? What are the consequences for what I'm doing? It's the part of your brain you don't develop till you're a late teen. That's why we don't give you driver's licenses before then. You can't think through things. And then you come to me and say, I have brain fog. I can't think through things. I can't remember anything. I'm not making any sense. I'm feeling confused. You're not feeding your brain. You're feeding the part that says, if I run faster than this guy, I can get away from that bear. Oh yeah, you're not going to poop either. Who has time to poop when you're running from a bear? So, all of this to say,
I would be pooping.
but while you were going, that might be an effective technique. All this to say is that your physician can give you anything they want orally. They can prescribe any natural medicine they want. They can tell you what nutrients to take and what sleep hygiene to follow and what foundations of health to do. And if your nervous system isn't balanced, it ain't gonna work. It's just not. That's it. That's all I had to say.
That was a lot, that was wonderful.
It was a lot. I'm here, I'll answer questions until 10 to 8. That's my boundary because I do have a toddler. And I'm tired. Go ahead.
I was just wondering, do you take insurance?
We do not take insurance, but we do provide super bills. Medicare doesn't qualify under super bills. If you have Medicare, then it's not accepted by us. Super bills are a form that we give you with your diagnosis code, similar to an insurance company, and then you send it to your insurance company and they can reimburse you for partial or full cost. If you have Medicare, here's what I'll tell you. I have a few conventional practitioners that I work really well with. Do not come see us because of insurance, hopefully. I do understand that there's financial restrictions for a lot of people. We offer a senior discount. I will never have never and don't plan on ever turning anybody away from my door if they want medical help. We will work it out. Period, dot, end of story. But there are other really great practitioners in the area that I work very closely with, especially in the neurologic field, that do take insurance and work really well with integrated medicine that I would be happy to refer you to and to partner with as far as ordering labs, helping with medication, different things like that.
So can you use the labs that